Well, folks, we are halfway through our week-long focus on women's health, and today we focus on a major killer. You hear the little heartbeat. We're talking about heart disease today. Every year, nearly 750,000 people die from heart disease here in the U.S.
It's nearly 30% of all deaths in this country, too. But there are ways, of course, to prevent heart disease and ways to lower your risk of developing it. Joining us now to talk about heart disease and prevention is Dr. Pamela Rama with the Jacksonville Heart Center. Also with us is Rebecca White of the American Heart Association.
Good morning,
Thanks, both of you, for joining us this morning, too. Doctor, let's first start with you about some of the warning signs. And a lot of people think, maybe you have to be overweight, out of shape, and then that's a warning sign of heart disease. But that's not always the case.
That's not always the case. I mean, heart disease can occur in skinny people, fat people. I mean, it doesn't really choose sex or race.
Yeah, and one of the warning signs too is you always hear this massive clutching of the chest. Right. That's not the case either, especially for women, right?
Absolutely. A majority of patients will present with the chest heaviness or tightness, but there is a greater proportion of women, particularly, who can present with other symptoms like fatigability or shortness of breath. Just not being able to do their housework can be a sign of heart disease.
And let's talk about screening. There are specific tests that can be used, and you've got a model here of what your artery can look like once it's blocked.
Well, the first thing to do is you have to know your risk factors. You have to know what your cholesterol level is. It's not enough to know what your total cholesterol level is. You have to know what your bad cholesterol, LDL cholesterol is, and your HDL cholesterol or your healthy cholesterol. There's other screening tests besides the lipid profile, knowing what your sugars are, your blood pressure. Those are the important things to know and the important numbers to know.
All right, and Rebecca White with the American Heart Association. Yes. This is such a huge deal that you actually have centered this around an event that you have every year.
That's
it's called
Go Red for Women.
Go Red for Women. And this is a great event once a year. And this year, it's going to happen in when? The spring?
It will actually be May 14th of 2010.
And what's the purpose of the luncheon?
Absolutely. Well, Go Red for Women is a national movement for the American Heart Association to raise the awareness of heart disease being the #1 killer of women. And the event is a fun-filled day that really helps to educate women on the lay person's level so that they know what to look for and understand what their risk factors are of heart disease.
And do you find that a lot of people in our area, because you're with the local chapter, do you find we don't know enough about heart disease?
We still don't know enough. I have conversations daily, weekly, even at the executive level, who still don't know heart disease is the #1 killer of women.
We talk about some of the preventive measures like the cholesterol, the weight, as well as your exercise, but they have CT scans now where you can scan your heart and then figure out if you're going to be at risk of heart disease or not. Now, you would think that might be a preventive thing for everyone, but that's not the case, right?
That's not the case, and we really reserve the CT scan for patients who are symptomatic, who have atypical symptoms, and you really don't know whether they have, heart disease or coronary disease.
But if I could know if I'm at risk, even if I'm healthy now, wouldn't that be a good thing, or is it the radiation part that's
well,
scary?
the radiation, they've figured out a way of doing the CAT scans so that the radiation is not too bad. But you will be able to see coronary disease with CT scan. That's no doubt. So if you were questioning whether I have coronary disease or not, then that would be a good test to do. But what it doesn't tell us is the plaque that you have there, is it an unstable plaque that can cause a heart attack this year, next year, or 5 years from now? The CAT scan's not going to do that.
And that's the unstable plaque, if we could take
absolutely
what's
here
coming out of the artery wall right here.
Yes.
Okay.
Yes.
So you got to have to watch out for that. Interesting stuff.
Dr. Pamela Rama, Rebecca White, thank you both so much for getting up early with us.
Thank you for having us.
All right.
Very important.
Also tomorrow on Good Morning Jacksonville,